Typically, patients present to neurosurgeons for a brain bypass referred from a neurologist or a vascular neurologist because they're having strokes. The overall treatment for a blocked carotid artery is medical management, using antiplatelet medications like aspirin and Plavix, making sure your blood pressure is in a nice range, and also making sure that you're on a statin medication like a Lipitor or Crestor. There are a small subset of patients that, despite the best medical management and the best care, continue to have strokes. They're just not getting enough blood flow to the brain. These are the patients that we see for brain bypass surgery, and they're candidates for the procedure. There's multiple small little arteries that are up in the scalp that we can use. We isolate that artery, take a small little window of bone off the skull, and we can see an artery on the surface of the brain. And we take an artery on the surface of the scalp and sew it to an artery in the brain. And that effectively bypasses the blocked artery and brings more blood flow up to the brain. It's actually a very delicate microsurgical procedure, about 1 millimeter big. So we're using suture about the size of a piece of hair. One of the things we worry about when we do brain bypass is that blood comes in from sort of a different direction. Typically it comes up the carotid artery, and now we're sort of sending blood in the other way. There is a small risk of having stroke postoperatively, but with good blood pressure and good neuro ICU support, that risk is very small. Most patients after brain bypass surgery can go home about 2 to 3 days after the procedure. If a patient presents with stroke and we do the bypass, sometimes people need a longer recovery time just to get over the symptoms of the stroke that they had. If patients come in sort of in a delayed fashion, they've had a stroke in the past and we're doing surgery to prevent another stroke, and then probably overall recovery about a month or two, where they're just sort of feeling less endurance and a little bit more tired at home, maybe a little more headache, but overall pretty quick recovery. If you're considering having a brain bypass surgery, it's very vital that you go to a place that has a comprehensive team that can take care of you throughout the surgery and then in the neuro ICU afterwards. Here at the Cleveland Clinic, we do some of the highest volumes of brain bypass surgery in the country.